that email lands in your inbox, or maybe it's a notification from your patient portal, your lab report, and instantly there's that little knot of anxiety, just rows of numbers and abbreviations. What does it all mean?
It's a feeling I've seen countless times over 15 years. There's this sense of being tested, but I really want us to reframe that today. Think of it less like a test you pass or fail, and more like a tool, a really powerful one, actually. So, the mission for this deep dive is to walk you through the 5 key things to look for to help you turn that confusion into confidence.
I like that. A tool, not a test. That feels much more empowering. So, tool in hand, what's the very first thing? Key number 1?
Right. Key number 1 is understanding the reference range. You'll see it next to almost every result. This range basically shows what's considered normal for a large group of people. But, and this is important, normal can shift a bit based on your age, your sex, and other factors.
Ah, so it's not just one universal normal.
Exactly. And if your number is slightly outside that range, it's not usually a reason to panic. Think of it more like a yellow flag. It's a signal, really, a prompt to have a conversation with your doctor, not, jump to conclusions.
Got it. A conversation starter, not a diagnosis in itself. Okay, so we understand the ranges. What's key number 2? What specific tests should we look at next?
Key number 2 would be your white blood cell count, the WBC count. These are often called your immune system's army, and that's a pretty good way to think about it. We look at this to get a feel for your immune activity. So a high count often means your body's fighting something, an infection, maybe inflammation.
The body's defense system in action.
Precisely.
Okay, what about energy? I mean, so many people, especially dealing with chronic stuff, just feel wiped out all the time. Does blood work show anything there?
Absolutely it does. And that brings us straight to key number 3, your red blood cells, or RBCs, and maybe even more specifically, hemoglobin. These are your oxygen couriers. They ferry oxygen from your lungs to, well, everywhere else in your body.
The body's delivery service for oxygen.
You got it. So when these numbers are low, that's what we call anemia. Your body just isn't getting the oxygen it needs efficiently. And that is often a direct physiological reason for that really deep, profound fatigue people describe. It's not just in your head.
That's such a critical link to make. Okay, you mentioned inflammation earlier when talking about WBCs. How else does that show up? What's key number 4?
Yeah, inflammation. Key number 4 is crucial, especially if you deal with chronic pain or conditions. We look for specific inflammation markers. A really common one is C-reactive protein, or CRP.
CRP. Got it.
Think of CRP as your body's general fire alarm. When it's high, it tells us there's a fire, inflammation, happening somewhere.
A fire alarm. I like that analogy, but it doesn't tell you where the fire is.
Exactly. It signals there's an issue, but not the specific cause or location. It could be an infection, an injury, even chronic stress. It's a really important flag that tells your doctor, okay, we need to investigate why this alarm is going off.
Okay, that makes sense. So we've got ranges as our baseline, white cells for immune activity, red cells for oxygen and energy, and inflammation markers like CRP as the fire alarm. That covers a lot. What's the final key, the big takeaway?
Key number 5 is maybe the most important mindset shift. It's remembering the big picture. Your lab report, it's a snapshot. It's just one moment in time, not the whole movie of your health.
A snapshot, not the whole movie.
Yeah. Its real power, its real purpose is to start a good and informed conversation with your doctor. Knowing these key things helps you ask better questions, understand the recommendations, and really partner with your doctor. Ultimately, this understanding empowers you to be the best advocate for your own health journey. That's the goal.
That really does shift the perspective from anxiety to action. Thank you. That was incredibly clear and helpful. For everyone listening, if you want a written guide summarizing these points, just check out the link in the description. And please, do subscribe so you don't miss our next evidence-based wellness deep dive.